Hi, I'm Dr. Tony Weston. Unmasking stress and anxiety, how trauma, mind, and body connect. Stress and anxiety touch every aspect of our lives, but what if I told you they don't just live in our minds? They carve paths through our bodies, affecting how we move, breathe, and even how we heal. Today, we'll explore the deep connections between stress, anxiety, trauma, and our physical body. 1. Setting the stage. Stress and the mind-body connection. Stress and anxiety often appear as racing thoughts, overwhelming emotions, or a pounding heart. And the reality is, these experiences ripple far beyond our brain. Stress triggers a cascade of physical reactions. Our muscles tense, our breathing changes, our gut churns. This is our body responding to what it perceives as a threat. It's part of our evolutionary survival response, what we often call fight, flight, freeze, or fawn. Imagine you're preparing for a presentation, suddenly your palms sweat and your heart races. That's the stress response in action. 2. The neurobiology of stress and anxiety. When you feel stressed or anxious, your body activates the sympathetic nervous system, flooding you with cortisol and adrenaline. These hormones prepare us to respond to danger and also come at a cost. Chronic activation can lead to health issues like high blood pressure, immune suppression, and even digestive disorders. This is why people with chronic stress often experience fatigue, headaches, or even chronic pain. 3. Psychological dimensions and physical symptoms. Our thoughts and perceptions matter. Cognitive distortions such as catastrophizing or black and white thinking can heighten stress and anxiety. Imagine a small setback spiraling into a perceived disaster. Our brain sends signals that something is wrong and our body responds in kind. Over time, this mental strain depletes our energy, what we call ego depletion. When our mind is exhausted, our body feels it too, manifesting as fatigue, muscle tension, or even burnout. 4. Trauma, complex trauma, and the body's response. For many, stress is not just a reaction to daily pressures, but a reminder of past trauma. Childhood trauma, in particular, leaves lasting imprints. Those who experience complex trauma, ongoing or repeated adversity, may feel stuck in a heightened state of alertness or emotionally numb. These are not just psychological experiences, they're deeply physical. For example, hypervigilance can cause chronic muscle tension, while emotional numbing may lead to fatigue and disconnection. 5. The impact of attachment styles and rejection sensitivity. Attachment styles shape how we relate to stress. Anxiously attached individuals may experience physical symptoms of worry, such as a racing heart or gastrointestinal issues, while avoidant types may internalize stress, leading to chronic tension or isolation. Those sensitive to rejection may have heightened stress responses, often leading to inflammation or immune system changes. In the description, I'll put a list of some of the things that are affected here. 6. Cognitive and behavioural patterns, breaking the cycle. Many of our physical responses are learned, patterns formed in childhood, repeated in adulthood. Habits, routines, and even thought patterns influence how we react to stress. Mindfulness and therapy interventions can help break these cycles, reducing stress-related physical symptoms. 7. The physical health connection and somatic symptoms. Stress often shows up as somatic symptoms, headaches, chronic pain, digestive issues. When we ignore these signs, they worsen. Approaches like breath work, yoga, and mindful movement can reconnect our mind and body, offering relief. For example, the 4-7-8 breathing technique. Breathe in for a count of 4 through your nose, hold for a count of 7, and out through your nose for a count of 8. Calms the sympathetic nervous system. 8. Healing strategies for stress and anxiety. While stress and anxiety impact our bodies, they don't have to control us. Healing starts with awareness. By acknowledging how stress manifests physically, we can take steps to manage it. For example, some practical tools are journaling, for stress triggers, breath-focused mindfulness, and seeking therapy when needed. So, in conclusion, finding hope in healing. Stress and anxiety are complex and they're not insurmountable. Understanding the connection between mind, body, and past experiences allows us to break free. Healing is possible with compassion, awareness, and care. Thank you for watching.